Hi guys! Welcome to my vlog, and today naghanda ako ng mga bagay na makakatulong sa akin throughout this whole school year. So, in a bit, mag-start na yung aming class.
Good morning, class.
Good morning, sir.
Today, we are going to tackle the different concepts in between the genes and the prenatal development. But first, let's talk about the genetics. So, genetics, it is the branch of biology that deals or concerned with the study of genes, genetic variation, and heredity as well in an organisms. So, skins make up our skin, and the liver cells make up our liver. Our bodies require about 200 different types of cells to be formed. Each cell has genetic information that tells it to be a particular type of cell in which that does the job of at the head. So prior to what we have discussed a while ago about the genetics and cells, I have a question for you if you are familiar about the DNA. Okay.
So, sir, ako po. So, 46 chromosomes tightly packed with DNA, humans have 23 chromosomes inherited from their father and 23 chromosomes inherited from their mother. Sex is determined by 22 pairs of autosomes and 1 pair of sex chromosomes. So, the X chromosomes and the Y chromosomes. Yun lang po.
Yes, it is correct. So, in addition to that, it is according to the study of Gregor Mendel about the trait inheritance. This is somewhat the patterns that weight traits are handed down from the parents to offspring. He observed that organisms inherit trait by ways of discrete units or the units of inheritance. This term is still used today. It is ambiguous explanation about the genes. So are we clear on that?
Yes, sir.
Now let us proceed to our next topic. This is referring to the genes and experiences interacting in the womb. We used to think that the womb is the protected environment for the developing fetus, with the placenta acting as a shield between the womb and the outside world, despite the fact that the placenta can serve as a filter. We now know that the fetus can be harmed if the mother is malnourished. Formation may be thrown off by genetic and other congenital factors. Stress and anxiety in the mother may have a direct impact on the baby's health. When infant toddler teachers keeps in touch with expectant parents on a regular basis, they will provide knowledge and service to help them with have the best pregnancy possible.
Hi guys! Welcome ulit sa aking vlog, and today I have a very good and exciting news kasi may blessing na dumating, and yun nga, I'm 12 weeks pregnant, and I'm a little bit worried kasi first time child and first time mommy. So, ayun nga, paano ko ba siya i-handle as a first mom? Yun. So, sana kung may mga suggestion kayo, you are free to comment on the comment box. And, ayun nga, sana subaybayan nyo ang aking journey as Preggy. Yun lang. Thank you.
Hi, Mommies. I am Dr. Lecter, a doctor from the Johns Hopkins University, and I am here with you to give a prior knowledge about the premature birth. You can also drop your knowledge in addition to what I am discussing here. You can also ask for something with regards to the topic, which is the premature birth. So, not all babies survive the entire 40-week gestation period. Premature babies are those born before 37 weeks of pregnancy. Prematurity may have a variety of causes and consequences. Medical intervention, on the other hand, has progressed to the point that more than 90% of premature babies weighing 800 grams or more, a little less than 2 pounds, survive. Those that weigh more than 500 grams, or just over 1 pound, have a 40 to 50% chance of surviving, but complications are more likely. Infants that are closer to full term and weigh more have a higher chance of surviving. Developmental problems are common in premature babies. So next slide is the risk factors for premature birth. So the first one is age. Pregnant people under the age of 18 and over the age of 30 have the greatest risk of going into labor early. If your age puts you at increased risk for preterm labor, you will need to reduce any other risk factors that you have. So the next one is alcohol use. No amount of alcohol is safe while you are pregnant. Preterm delivery is just one of the many risks associated with drinking alcohol while you are pregnant. So the third one is chronic high blood pressure. Having high blood pressure before you got pregnant puts you at high risk for early birth. Developing a condition called preeclampsia also increases the risk. Early prenatal care can help doctors and midwives to diagnose and treat preeclampsia or other hypertensive disorders of early pregnancy, reducing the risk of complications. Diabetes. If you have type 1 or type 2 diabetes before pregnancy, even for pregnant people who have been well controlled for many years, keeping blood sugar within a healthy range can reduce the risk of premature birth and other risks of diabetes during pregnancy. Next is lack of prenatal care. The later prenatal care begins, the greater the risk of health complications during pregnancy. Make a doctor's appointment as soon as you find out that you are pregnant. A lack of or delayed prenatal care are both associated with preterm delivery. Next is multiple pregnancies. Pregnant people who are carrying multiple, like twins, triplets, or more, are at an increased risk for early delivery, as well as other complications. Learning more about carrying multiple can help you work with your doctors to ensure a healthy pregnancy and safe delivery. Next slide. So the first one is poor nutrition. Pregnant people with an extremely low body mass index have a higher risk of preterm delivery. Pregnant people with generally poor nutritional status also have a greater risk. Maintain a healthy weight and eat a balanced nutritious diet while you are pregnant. Prior premature birth, having one premature baby puts you at an increased risk of having another preemie. This risk also increases if your pregnancy are close together or if you have additional risk factors. Controlling other risk factors can help reduce the risk of having a second preterm birth. Next one is smoking. Smoking cigarettes is one of the greatest risks of premature delivery, but it's also one that you can control. Aside from the risk of premature birth, there are other health risks the fetus and newborn associated with nicotine and cigarette smoke. Talk to your doctor or midwife if you need help quitting. Next is untreated infection. Infections, especially those of the uterus and urinary tract, can increase the risk of premature birth. Having a high white blood cell count is a marker of infection, is the best predictor of preterm birth from 22 to 27 weeks of gestation. Next is uterine or cervical problems. Uterine infections, cervical insufficiency, and placental abruption can all lead to preterm labor and birth. So our next topic is the postnatal brain development. The first 3 months of life are sometimes referred to as the fourth trimester of gestation. Human babies are born after 9 months in the womb, but they still have significant developmental tasks before them. Although the brain has been growing and becoming more complex, at birth it is only 25% of its adult weight. The lower parts of the brain, the spinal cord and cortex, are well developed, but the higher levels of the brain are quite immature. The lower brain controls much of the newborn's activity through reflexes. Adults protect the infant brain by keeping the world quiet and peaceful and listening to the baby's needs. So adults may communicate to newborns in two ways. The first one is touch. Touch is one of the most powerful sensory experiences for a young infant. Sucking on things, feeling them with their hands, and kicking at them with their feet are all ways infants learn about the environment. Physical discomforts, such as hunger or wet diapers, are met with loud cries and they are suited by being kept to their caregiver's body or swaddled snugly. So the next one is language. Infants master language by listening to the language around them even before they can speak a single word. To learn a specific language, the infant brain must develop a structure that understands and avoids the distinctive sounds of the child's own language. So that's all for our online orientation. I hope you learned something so that you can share it with other mommies too.
Hello, sis! Ayun nga, kasi nga, di ba, buntis ako yun. Tapos, I'm a little bit worried kasi kung may mga kinakain ba ko or may mga nakaka-apekto ba sa sa mga pagbubuntis ko. Yun nga, so, gusto ko lang sana tanong kung may alam ka ng mga online consultations or seminars para sa mga katulad nating buntis.
Honestly, hindi kasi ako ma-attend sa mga ganyang seminars but I do attend a consultation with my OB. But if I find one seminar, I'm gonna tell you and para makasali na rin ako.
Okay sis, thank you. Hi guys! Welcome ulit sa aking vlog and ayun nga, gusto ko magpasalamat sa mga tao nag-comment and nagpadala ng kanilang concerns and advices through comment boxes na nagsasabi na magiging ma-RT ako, magsusuka ako, magiging mahihiluin akong tao and ayun nga, meron daw ako mga magiging cravings na medyo weird and ayun nga, lahat yon naranasan ko. So, thank you talaga sa lahat ng inyong concerns and supports. Ayun nga, so let me tell you my experiences. So, yun nga, tuwing morning kasi, nagsusuka ko and nahihilo ko, hindi ko siya maintindihan kung bakit walang araw na hindi ko siya na-experience. And second is that, yun nga, meron akong mga weird cravings na once na hindi ko makuha, nag-i-NRT ako. So, katulad nun is yung champurado sa ketchup. Awful siya tignan, pero para sa akin, medyo masarap siya. Masarap siya. And, ayun nga, meron din yung saging na saba na isasaw-saw mo sa bagoong na isda. So, masarap siya guys. Masarap siya. Kahit weird ang aking mga cravings, masarap siya. And, ayun nga, sumali kasi ako ng online consultation kasi, yun nga, for the preparing of my pregnancy. Kaso nga lang, medyo nakulangan ako kahit na-discuss yung about sa pregnancy. Kasi talaga may mga hinahanap pa ako, mga katulad yung factors na nakaka-apekto sa pregnancy and paano ba yung mga, ano ba yung mga dapat kong kainin as pregnant woman na talagang makakatulong sa healthy body living. So, yun nga, kung meron kayong mga alam na online consultations and seminars, guys, please comment on the comment box. Okay? So, thank you ulit sa inyong support. God bless you. Uy, sis, yun nga, napatawag na ako kasi, ayun nga, naka-receive kasi ako ng email about sa isang organization and they are inviting me to join their seminar. Do you want to join? Oo, sis, makakatulong to para sa ating pregnancy. Okay, sis, sabihin mo na lang agad sa akin ha, para masend ko agad sa'yo.
Sis, feeling ko maganda yan. Interested ako dyan. Sige, sasali ako. Pasend nga ako ng link, please.
Hello, Doc Stella. Good morning po.
Good morning, Mrs. Lopez. Kamusta naman po kayo, Mrs.?
Ayun nga po, Doc. So, ayun nga po, puro excitement naman po yung nararamdaman ko since ilang months na lang po malapit na po lumabas si baby. Kaso nga lang po, Doc, gusto ko po kasi malaman kung ano po ba yung mga nutritional and not nutritional foods na pwede ko pong kainin para paglabas po ni baby, malusog po siya.
Ang pagkakaroon ng isang malusog na baby ay nasa sa iyo bilang ina. Kailangan mo magkaroon ng disiplina sa dami at uri ng iyong kakainin dahil ang kalusugan mo ay konektado sa kalusugan ng iyong magiging baby. Upang masiguro ang kalusugan ng iyong baby, kailangan mo kumain ng mga pagkaing mayabang sa calcium, calories, protein, vitamins, and minerals.
Doc, ano po ba kaya yung mga pagkain na yun?
Meron tayong tinatawag na basic food groups na pwede mong sundin. Ito ay nilalaman ng uri at dami ng pagkain na good for nutrition ng iyong baby at iyo bilang mami. Ito ay ang sumusunod. 4 or more servings of fruits and vegetables for vitamins and minerals. 4 or more servings of full grain or enriched bread and cereal for energy. And 4 or more servings of milk or milk products for calcium. Mainam na uminom ng gatas para sa mas matibay na buto ng iyong baby. At syempre, 8 glasses of water for hydration. Kailangan mo namang iwasan ang mga pagkaing hilaw o pagkaing hindi naluto ng mabuti. Mga isda, pagkaing dagat, itlog at molusko. Ang mga isda kagaya ng swordfish at king mackerel ay hindi naman dapat kainin habang nagbubutis. Iwasan ang pagkain ng hotdog, luncheon meat at cold cuts maliban na lamang kung ito ay inisting bago ihay.
Napakarami naman po palang nutritional and non-nutritional foods, Doc. Pero, sige po, Doc. Noted po silang lahat.
Mrs., maliban po sa pagkain ng tama ay kailangan niyo rin po mag-take ng supplements. Ang supplement bago manganak ay iniinom araw-araw. Ito ay makakatulong na makasigurado ikaw ay nakakakuha ng tamang sustansya na talaga namang napakahalaga sa iyong sanggol. Kabilang sa mahalagang sustansya habang nagbubuntis ang folic acid. Tumutulong ang folic acid upang maiwasan ang ilang problema sa iyong sanggol. Mainam naman na mag-take ng iron, calcium at vitamin D habang ikaw ay nagbubuntis. Siguraduhin lamang na tinitake ito sa magkakaibang oras dahil ang calcium ay ginagawang mahirap para sa iyong katawan na i-absorb ang iron. Ang pag-inom ng iron na may kasamang katas ng kahel ay makakatulong naman na pataasin ang pag-absorb nito. Yun lamang, Mrs. Sana ay matandaan mo ito para sa iyong malusog na baby.
Maraming salamat, Doc. Sasabihin ko po ito sa aking asawa para po sabay po natin magabayan ang healthy baby. Thank you po.
Good morning, mga mamshis. I'm Doc Stella and welcome to our program entitled Pregnancy Health, a Healthy Mom Towards Healthy Babies. I'm sure that most of you ay narinig na ito, na isinisilang ang isang malusog na baby mula sa kanilang malusog na mommy. Today, as your first speaker, I will give emphasis sa mga habits na dapat bawasan o tuluyan ng itigil dahil sa maaaring dulot nito sa pagiging healthy ng iyong baby. So, I will start this with a question. Mga momshies, kumukonsulta na ba kayo sa malapit na health center o doktor? Mukha namang most of the momshies here ay talaga namang kumukonsulta, ano? So, it means, aware na kayo sa mga pagkain dapat bawasan or damihan kapag ito ay kakainin. So now, I will give emphasis sa mga habits mo before pregnancy and how it may possibly affect your baby if you're still engaged in those habits. But I will just focus on 3 bad habits that a pregnant woman must stop during pregnancy. First, a pregnant women are not advisable to drink alcohol, even just a small amount of it, because it puts you and your unborn baby at risk. The alcohol that the pregnant woman drinks passes from her blood to her baby's blood through the placenta. When you drink, your unborn baby can get about the same concentration of alcohol in its blood as you do in yours. On the other side, women who drink while pregnant also put their own health at risk due to the some effects of it, such as vomiting, dehydration, high blood pressure, nutritional deficiency, and gestational diabetes. Sa madaling salita, there is no safe time to drink alcohol while pregnancy, mga momshies. You'll probably feel more tired than usual, and as your baby gets bigger, it will become harder for you to find a comfortable position when you're trying to sleep. Second is lack of sleep. Sleep is essential to our health, especially if you are pregnant. Lack of sleep is associated with many chronic diseases including type 2 diabetes, obesity, depression, and even heart disease. If you're pregnant, not getting an adequate amount of sleep can put you at risk for some serious conditions. Do you know that lack of sleep can also complicate your delivery, mga momshies? Lastly, ang pagkain ng salty at junk foods. Women have naturally some pretty crazy cravings during pregnancy, and we do understand that. But you should always consider its components, if it is beneficial to your baby or not. Junk food doesn't provide the nutrients necessary to support the proper growth and development of your baby's body, including his brain, bones, immune systems, and its organs. Here are the possible ways that junk food affect you and your baby. First, the baby develops liking for fatty foods. It may also increase the risk of allergies. It higher the chance of genetic abnormalities. It also may result in an increased intake of acrylamide. The chances of gaining excess weight might be higher. Junk foods have zero nutritional value. It might lead to digestive problems and risk of gestational diabetes. Healthy eating is always important, but especially when you are pregnant. Pregnancy is a time to be cautious about foods and eating healthfully. Breaking bad habits takes time and effort, and mostly it takes perseverance. But since your responsibility is not within yourself, it is already within you and your baby. I hope you learn a lot from our discussion. So for the next topic, prenatal development. The first trimester. The fetal development begins when sperm cell enters the right egg or ovule. When the ovum and sperm combine, the cell quickly multiplies. It travels down the fallopian tube to implant itself in the uterine wall on 6th day of after conception. Ang placenta ay magde-develop para ma-nourish at mag-supply ng oxygen sa fetus. Ang unang linggo ng conception ay ang start ng pag-generate ng amniotic sac and placenta. The amniotic sac will hold the developing fetus, and the placenta will butt the amniotic fluid. The embryo will develop into 3 layers of cells. First, ectoderm will become the brain, sensory organ, and nervous system. Second, the mesoderm, which will become the circulatory, skeletal, and muscular system. And third, the endoderm, which will become the digestive and glandular system. During the first 3 months of pregnancy, the cells rapidly multiply, but they also begin to differentiate into blood cells, liver cells, nerve cells, and so forth. External features such as eyes, ears, arms, and legs, and the external organs will begin to form. Although they are less than 3 inches fetus, they can make fists, they can move their arms and legs. They will begin rudimentary sleep and walking cycle, wrap, suck, and swallow. Ang embryo at fetus ay kailangan ng magbusising paggabay at pag-iingat, sapagkat ito ay vulnerable in the first week of gestation. Ang second trimester naman ay ang 4 to 6 months of gestation. Ito ang oras kung saan ang growth and development ang pinakakailangan. The fetus will grow about 15 inches and weighs about 2 pounds and 11 ounces. Ang fetus ay aktibo about half the time na kuminsan ang nanay ay nararamdaman ng movement, heartbeat at pag-iyak ng bata na maririnig lamang gamit ng stethoscope. Ang ikatlong semester naman ay ang fetus could survive premature birth, but the potentials for complications is high. The brain is rapidly developing, perhaps the part is stimulated by movement, light, temperature changes, and sounds. Listening through the noises of the womb to the voices of her family, she may be learning sound through his or her family language. Pagkatapos manganak, ang bata ay able na makapag-recognize ng story na paulit-ulit binabasa ng malakas during the gestational period. The fetus gains body fat and grows quickly to fill the entire uterus. Over 40 weeks, the human being grows from one cell into complex, competent human being who is able to hear, react, and learn. Yun lamang po mga momshies. I hope you learn a lot from our discussion. So for our next speaker, Dr. Garcia will be discussing the structure of the brain.
Hi! Magandang umaga sa inyo. Ako nga pala si Dr. Garcia na magbabahagi ng impormasyon sa inyo patungkol sa struktura ng utak. Ano nga ba ang kahalagahan ng pagdevelop ng ating brain lalo na sa mga bata? May nakakaalam ba dito? Ating brain development ay nagsisimula within the first days following conception. Ang structure ng ating mga utak ay nagsisimula by 4 weeks following the conception. Ang embryo ay 1/4 inch long, kasabay na pagdevelop ng ating utak ay ang pagbuo din ng iba't ibang internal organs ng ating katawan. The future brain and nervous system becomes apparent as a spoon-shaped structure, only one cell thick known as the neural plate. Over the next several weeks, fetal brain cells or neurons are generated at about 200,000 per minute and the brain develops 3 areas, the forebrain, the midbrain, and the hindbrain. Ang forebrain ay magiging cerebrum. Ito ang responsible para sa controlling, thinking, and language. Ang midbrain naman ay ang magiging thalamus and hypothalamus. Ang trabaho niya ay mag-control ng passage of sensory information. At ang pinakahuli ay ang hindbrain. Ito naman ang tinatawag nating cerebellum. And the brainstem na ang trabaho ay ang mag-control ng heartbeat, respiration, and motor development. Sa loob ng 5 buwan ng gestation, ang ating brain ay unti-untong nabubuo pero malambot. Pagkapanganak sa mga bata, ang babies ay mayroong about 100 billion brain cells. Ito ay doble sa bilang kaysa sa adults. Ang ganitong kadaming brain cells ay tumutulong upang ma-ensure na ang mga babies ay may panganak na may healthy brains and will be able to learn whatever they need to survive in their unique environment. At ang susunod na speaker ay si Dr. Mark at tatalakayin niya ang epekto ng stress at violence sa brain development ng isang bata.
Salamat partner. So ano nga ba ang epekto ng stress and violence sa brain development? The National Scientific Council on the Developing Child suggests that there are 3 levels of physical stress. It responses in young children. These are the positive, tolerable, and toxic. The positive stress responses are mild and of short duration. Most importantly, a responsive adult with whom the child has a meaningful, ongoing relationship buffers the child's experience and helps calm him. Negative stress might occur with the vaccination or allowed. Positive stress is helpful to a child's growing ability to deal with difficult situations. A tolerable stress. Its responses occurs when there is a drastic, life-changing event such as the death of a parent, divorce, a serious illness, or a natural disaster. It responds with long or lasts longer but may not cause long-term damage to the brain if there is an adult helping the child through the experience. Fetuses and very young children who live in homes with abuse, violence, mental illness, or substance abuse maintain their stress response much of the time. Children who experience toxic stress in infancy have brains that work differently later in their life. They, they may be in a state of hyperarousal that always is scanning the environment for signs of danger. These children may even evoke in others the abusive behavior that they fear, just to have some control over it. Therefore, a boy whose mother was raging and frightening may pick fights with other children, or a girl who was sexually abused may act seductively with a teacher. The opposite reaction to earlier frightening experiences is to feel so powerless that the child just freezes or dissociates. During dissociation, the child may not even hear what is said to her, and so she does not attempt to respond. The child may not have no memory of the experiences. If children do not have reliable, responsive caregivers, they may not even develop the neuronal pathways that would present adult assistance as a possible solution to that problem. If the children experience extreme deprivation in infancy, little contact with caregivers, and little stimulation from the environment, they will develop significantly smaller than normal brains. The brain may incorporate the effects of chronic frightening or neglectful early experiences for a lifetime.
Ang susunod na programa ay rated PG. Patnubay at gabay ng magulang ay kailangan sa mga batang manonood.
I am here to explain to you what is prenatal healthcare and bakit nga ba to importante para sa mga mommies and incoming mommies pa lang. So, ano nga ba ang prenatal healthcare? So, prenatal healthcare is when you get check-up from a doctor, nurse, or midwife throughout your pregnancy. Also, makakatulong din ito sa'yo to keep you and your future baby healthy. So, in fact, if a woman is planning on becoming pregnant, she will want to start seeing a doctor in preparation. Babies of mothers who do not get prenatal care are 3 times more likely to have a low birth weight and 5 times more likely to die than those born to mother who do get care. So, ang goal ng prenatal healthcare is to minimize the mortality for both mother and fetus to maximize the chance of a safe delivery. Always remember that understanding your patient's medical history is very important kasi it can affect the health of the pregnant woman and also the fetus. So, tuwing kailan ka nga ba pupunta sa iyong doktor para makapagpa-check up? So, ang typical prenatal care schedule for someone who is 18 to 35 years old is every 4 weeks or 6 weeks for the first 32 weeks. Every 2 or 3 weeks for the 32nd or 37th weeks. Every week from the 37th week until the delivery. So, your doctor might ask you to come in for checkups more often if you have a high-risk pregnancy. So now, we will answer the question why prenatal health care is important. So guys, prenatal health care is important part because it will help you to monitor and staying healthy during your pregnancy. In this part, yung doctor mo is the one who will monitor kung yung baby mo ba sa tiyan is nagde-develop and healthy. And if not, they will do some routine testing to help you prevent possible problems. Also, these regular checkups are also a great time to learn how to ease any discomfort you may be having and ask any other questions about your pregnancy and the birth of your future baby. Dito din i-explain ng doktor yung information about your labor and delivery. So, prenatal health care also promotes the health of mother and child. Nutrition information is supplied. The health professional will track the baby's growth and development. So, expectant women are advised to avoid hot baths or hot tubs, smoking, alcohol, and street drugs. They are told to avoid cat litter, contact with rodents, and chemicals such as insecticides and solvents. Also, lead, mercury, and paint. Women are advised to get exercise, get enough sleep, and reduce stress in their lives. So, hi guys, I am here again to explain to you about the toxins and teratogens. We all know that it is very harmful for every pregnant woman because it can affect the fetus and the womb. So, ano nga ba ang teratogens and toxins? These are the chemicals, physical, or biologic agents that are able to induce development and abnormalities. So, teratogens may also induce developmental abnormalities by altering patterns of gene expression, inhibiting cell interaction, or blocking morphogenetic cell movements. It is an environmental agent that can cause abnormalities in exposed fetus. Teratogenic agents can be environmental chemicals, material metabolic factors, drugs, or infections. So, many substances in our environment threaten the positive development and cause of disabling condition in the fetus. So guys, it is important for every pregnant or expected pregnant woman na malaman yung mga informations about these substances na pwede makaapekto sa pagde-develop ng fetus sa tiyan. So guys, stress, nutrition, infections, and other microbiome can also play a role in altering genes programming and expression during embryonic and fetal growth. Cocaine use appears to be related to premature births and smaller babies. So, a contributing factor to possible negative effects of cocaine use is that mothers who use cocaine prenatally show less sensitivity and more negative effect with infants and are angrier and aggressive with their toddlers. So, although researchers are not exactly sure about how smoking damage a fetus, they assume na ang cigarette smoking can limit the availability of oxygen sa tiyan ng nanay. So, nicotine can causes blood vessels to constrict and carbon monoxide binds them hemoglobin which carries oxygen through the body. So, 20 or 30% increased risk of having shortened or missing arms and legs, cleft lips and cleft palates, and abnormality shape of heads and faces. 27% increased risk of gastrointestinal abnormalities including problems with the throat, esophagus, colon, intestine, bile ducts, gallbladder, and liver. So next is 50% increased risk of being born with their intestines outside of the body. So 20% increased risk of being born with a blocked or closed anus. And 9% increased risk of heart defects. 13% higher risk that the baby boys would be born with undescended testes. So now I will be discussing the toxins that may lead to miscarriage, premature birth, low birth weight, and developmental delays. So first is lead. It is present in drinking water through old lead, plumbing pipes, or old paint. So next is mercury. It is stored in a fatty tissue of most fish. So third is arsenic. Exposure may occur through industrial workplaces and cleaning products and solvents often used in the home. So the fourth one is cleaning product like insecticides and other products that may use in our house. And lastly is the chemical solvents. So, however guys, in areas where there is a danger of West Nile virus or Lyme diseases, it is suggested that a pregnant woman can also use small amount of cleaning products sa mga gamit and dapat gumamit ng gloves pag gagamitin ang mga cleaning product na ito. So guys, mothers should always think about the products that they are using because it can harm the fetus inside the womb. Importante sa mga pregnant women or expected pregnant women na maging maingat para maging safe and healthy ang baby sa tiyan.
Dok, yung anak ko po.
Dok, yung anak ko po.
Dok, yung anak ko po.
Maraming mga problema sa pagbubuntis ay hindi natin inaasahan. Minsan, para sa mga kadahilanan, hindi pa namin lubos na naiintindihan. Ang mga maling iyon or anyo ay nangyayari sa panahon ng pagbubuntis. Missing chromosomes, abnormal genes are carried by one or both parents, and inaccurate migrations of cells can cause a variety of malformations in the fetus. Ang cleft palate ay maaaring sanhi ng isang kombinasyon ng mga factors na ito. Metabolic disorders na isa sa 3,500 babies katulad ng Tay-Sachs or Phenylketonuria or PKU ay isang genetic diseases na maaaring maging harmful at ikamatay ng sanggol. Infectious agents ay maaari ring maging sanhi ng birth defects, katulad ng Torch syndrome ay maaaring maging harmful sa fetus. Maternal infections such as rubella and cytomegalovirus na nakakaapekto sa 3,000 to 4,000 babies kada taon. Ito ay maaaring maging sanhi ng mental retardation, blindness, or deafness. This occurs early in the pregnancy. Sexually transmitted disease may result in stillbirth, newborn death, or bone defects. At noong 2015 at 2016, mayroong bagong mosquito-borne virus na pumukaw ng atensyon ng buong mundo. Ito ay ang Zika virus. Nagsanhi ito ng higit kumulang 4,000 babies na nagkaroon ng maliit na utak at ulo o ang tinatawag na microencephaly sa Brazil. The virus has been found in more than 20 Central and Southern American and other tropical countries at nagdeklara ito ng World Health Emergency Concern for the birth defects. Inabisuhan ang mga babae na maghintay muna ng 2 taon pagkatapos ng outbreak bago mabuntis. In contrary ito dahil ang mga bansang apektuhan ay hindi naman easily accessible ang birth control.
Ang mga emotional experiences na ating mararanasan, lalo na kung ang buntis ay nakakaranas ng stress, anxiety, at depression, ay maaaring makaapekto sa kanyang pinagbubuntis.
Dok, na-anxious po ako ngayon. Masyado po akong nag-worry sa health ng aking baby. Hindi ko po alam kung yung mga tinitake ko po ba is makakabuti or makakasama sa kanya. Minsan nga po, hindi na po ako makatulog sa sobrang pag-isip. Normal lang po ba yun?
Kapag ang isang buntis ay nakakaranas ng anxiety, maaaring tumaas ang heart rate ng baby. Less blood flows to the uterus at maging resulta upang maging mababa ang timbang ni baby pagkapanganak. Kapag ang isang ina ay may mataas na level ng stress hormones tulad ng cortisol sa kanyang daluyan ng dugo, ang sanggol ay maaaring maipanganak na may mababang timbang, maliit na ulo, poor brain development, at mababang Apgar rating sa ilang minuto pagkatapos ng kanyang kapanganakan. Kaya importante na maging aware ang mga taong malapit sa mga taong nagbubuntis upang makapag-provide ng emotional support para matugunan ang stress at anxiety.
Dok, marami na po kaming competitor para kay baby. At stress na nga po ako eh. Ang dami kong iniisip. Kung saan kami kukuha ng pera para sa panganganak ko. Lalo na po ngayong COVID, Dok. Umuha ng mga hospital.
Mrs., normal ang pagkaramdam ng stress lalo na't madaming hormonal changes ang nangyayari dahil buntis ka. Human beings release the hormones cortisol and adrenaline in response to stress. Ang mga hormones na to ay nakapagpapatalas ng ating attention para tayo ay mag-respond ng mabilis sa isang emergency. Pero kung ang stress ay nagtatagal, maaari itong makasama. Ongoing exposure sa mga hormones na ito ay pwedeng mag-cause ng health problems. Sa pag-aaral ng rodent, kapag ang mga buntis na rodent ay nakakaranas ng mataas na antas ng stress, ang kanilang mga anak ay natatakot at mas reaktibo sa stress. Mayroon silang poor memory at learning abilities. And as they age, they have memory and cognitive problems.
Talagang gusto namin mag-asawa ang magkaroon ng anak. Bakit siya malulungkot?
Ang ilang mga sitwasyon sa panahon ng pagbubuntis ay hindi kilalang-kilala ngunit maaaring mapanganib sa ina at sa sanggol. Although familiar na sa atin ang postpartum depression, ang prenatal depression naman ay hindi pa masyadong kilala. Ang prenatal depression ay similar sa sintomas ng depression: poor appetite, fatigue, difficulty in sleeping, and mood swings. Both men and women may become depressed following pregnancy. Each may also suffer from parenting distress in the first weeks after birth. Maaring sleep-deprived ang mga magulang, kaya dapat tayong mga nalalapit sa buntis ay magbigay ng atensyon sa mga nararamdaman nila dahil ang pagbuntis ay isang kritikal na panahon. Ang intimate partner violence ay maaaring maging dahilan ng stress para sa ina, na may implikasyon sa kalusugan para sa sangkot. Mga pagkaantala sa paghahanap ng pangangalaga sa prenatal na may implikasyon sa kalusugan para sa sangkot. At hindi nasisiyan sa pagiging buntis na may implikasyon para sa relasyon ng magulang at ng anak. Gayunpaman, ang mga childcare at learning programs ay pwedeng mag-provide staff training pagdating sa domestic violence. Kaalaman tungkol sa community resources, mag-provide ng parent information brochures, at magplano ng safe space para sa safety ng nanay at ng kanyang anak, if necessary. So, what's up guys? Ngayon natapos na tayo sa kung ano mga bagay ang mga dapat nating malaman through pregnancy. Ang pinakakailangan natin ay ang ating knowledge. Kapag wala tayong knowledge about basics ng pregnancy, mataas ang chance na magkaroon tayo or ma-risk ang buhay natin at ni baby. So, mahalaga ang ating knowledge sapagkat dito papasok mga bagay na dapat natin isaalang-alang sa siyam na buwan nating pagbubuntis. Sa siyam na buwan nating pagbubuntis, alam natin na maraming bagay na pwedeng makaapekto. And ginawa ko ang vlog na to para magbigay ng knowledge sa mga darating at magiging ina at mga ina. Katulad ng mga simpleng problem, ang maaari palang makapagdulot ng mga masasamang epekto sa atin at sa ating baby, sa ating kalusugan, when it comes to mental and physical health. Ang mga simpleng bagay din makakapagdulot din sa atin ng mga stress, depression, and anxiety. And yun nga, ma-affect din sila sa pagiging soon-to-be mommy natin. Salamat sa mga professionals na nagbigay sa atin ng iba't ibang knowledge about pregnancy, genetics, nutrition, and brain development. Dahil dyan, mas napalawak natin ang isipan ng bawat isa. Hanggang sa muli, don't forget to click the subscribe button and ring the bell to get updates about vlogging ina ng channel. Vlogging ng ina mo channel. Yun lang. Thank you. Bye!